Then we'll come to the Trendelenburg position. This position was initially used by a German surgeon known as Friedrich Trendelenburg. What he was doing is, he just tilted the table down so that the patient is kept at head down. He used predominantly this procedure for abdominal surgeries. Later, American surgeon known as Walter Cannon, he popularized or improvised this position. Basically, he was using this position just to improve the hemodynamics of soldiers who are wounded in the World War I, especially when they are in the shock position. He observed the hemodynamics and he realized that whenever these wounded or the patients who are in shock are positioned in this position, the Trendelenburg position, their hemodynamic improves. Presently, we are using this Trendelenburg position for various procedures, especially for the abdominal procedures and laparoscopic procedures and robotic surgeries where we use steep head down, steep Trendelenburg position. Apart from surgical requirements, we use this position for central line placement as well as to treat the hypotension. So, what are the hemodynamic and respiratory changes that is going to happen in this position at C? As we have already seen, when the patient assumes from supine to Trendelenburg position, immediately there is going to be an increase in the cardiac output, and it is approximately to about 9%, and it happens within a short time, that is about less than 1 minute. That's because whatever the amount of blood that is in the legs, which is going to be transmitted back to the central circulation. Because of this cardiac output is increased. But remember, this hemodynamic change is very transient. Approximately by 10 minutes, the cardiac output begins to normalize. What about the respiratory mechanics? Since this position, this is a steep head down position, because of that, the abdominal contents are going to push the diaphragm down because of the gravitational force. This is going to cause this is going to reduce the FRC. When this happens in a spontaneously breathing patient, the work of breathing is going to increase, and which results in a very high airway pressure. Not only that, when you are putting this patients in this position, it is going to increase the intracranial pressure as well as the intraocular pressures. So, there may be a relative contraindication. This Trendelenburg position may be a relative contraindication for patients who are having high ICP. Okay. So, what are the other effects? But remember, whenever these patients, this is not a natural position. As a result, when these patients are kept in head down position or the Trendelenburg position for a prolonged period of time, there is going to be a venous congestion because of the gravitational force. As a result, these patients are going to develop some amount of swelling in the face, conjunctiva, larynx as well as in the tongue. When these airway structures are becoming edematous, this is going to cause there may be a possibility of patient developing upper airway obstruction. And also, as we have seen already, this is increasing the intra-abdominal pressure, as also displaces the stomach. There is a high chance that these patients are at the risk of developing aspiration. So, most of the time we prefer to have their airway secured by means of endotracheal tube. But another important point is, since these patients are kept in the head down position, there is a possibility that these patients may get slipped down. So, always make sure that these patients are properly restrained. At present, there are a lot of commercially viable measures are available, like anti-skid beddings or the knee can be kept flexed like this, so that the fall or rather the slipping of the patient can be avoided. So, whenever the knees are flexed like this, make sure that it is padded nicely. Sometimes you may have to keep you may to restrain the patient using this padded cross torso straps. Sometimes we may have to use the shoulder braces, but remember, the shoulder braces are known to produce compression and stretching of the brachial plexus, and as a result it can cause injuries to the brachial plexus. So, whenever you are using shoulder braces, you have to be little bit cautious. So, now coming to the reverse Trendelenburg, that is just an opposite of Trendelenburg position, where the head is in the up position and feet is in the down position. This is predominantly used for upper abdominal surgeries because the abdominal contents will be shifted down caudal. So the surgeon will have a free field. But again here you have to remember that there is a high possibility of the patient getting slipped. As a result, the restraining measures have to be taken properly. But when compared to the trundle and back position, the most important part here is the change in the hemodynamics, because you know that head is well above the heart. So there is a possibility that the patient's hemodynamic response may be compromised. As a result, there is a possibility that there is going to be a reduction in the perfusion pressure of the cerebrum. As a result, the CPP is reduced. So there may be a possibility of this complication. So you need to be aware of this.